Did you know that nearly 6.2 million adults in the United States are living with heart failure, and the vast majority of them are over the age of 65? Even more alarming is the fact that many seniors may be developing heart failure without even knowing it. Some medical professionals even refer to heart failure as the mini stroke of the heart, a silent threat that, like a TIA, transient ischemic attack, may appear mild at first, but serves as a serious warning sign of something much worse ahead. This silent condition can creep in gradually, often mimicking signs of normal aging, making it difficult to detect before serious damage occurs. But here's the truth. Early warning signs of heart failure are often subtle, but they are not insignificant. Left unchecked, they can progress into a life-threatening situation that drastically reduces quality of life, limits mobility, and leads to repeated hospital visits. What's worse, many of these early symptoms, such as shortness of breath, fatigue, or mild swelling in the legs, are often brushed off as just getting older. Heart failure doesn't mean your heart has stopped working. It means your heart isn't pumping blood as effectively as it should. And when the heart can't deliver enough blood to meet the body's needs, a cascade of problems follows: fluid buildup, oxygen shortage, and organ stress. Over time, this can impact nearly every system in your body, from your lungs to your kidneys and even your brain. According to the American Heart Association, 1 in 5 Americans will develop heart failure in their lifetime. It's a leading cause of hospitalization among seniors, with tens of thousands of older adults visiting the emergency room every year for symptoms they didn't even realize were heart-related. That's why understanding the signs early is absolutely essential, not just for treatment, but for prevention and quality of life. Think of these symptoms as your body's quiet cry for help, a gentle knock on the door before it turns into an emergency. Recognizing the early signs can help you or a loved one get the care needed to slow or even reverse progression. Let's take a closer look at the top early warning signs of heart failure in older adults, what to watch for, why they matter, and what you should do if you notice them. And pay close attention to symptom number 7. It's one of the most overlooked, but could be the key to catching heart failure before it becomes critical. 1. Shortness of breath during routine activities. You might notice that activities you once did with ease, like climbing stairs, walking to the mailbox, or even just getting dressed, now leave you breathless. This isn't just aging, it's your heart struggling to meet your body's oxygen demands. When your heart can't pump effectively, blood backs up in the lungs, making breathing harder. Over time, this can even lead to fluid buildup that causes wheezing or a persistent cough. If this symptom is present even during rest or while lying flat, it's a red flag that should be addressed immediately. Seniors often dismiss this as just getting old, but it could be the most urgent signal from your heart. 2. Persistent fatigue or weakness. If you wake up tired or feel wiped out after light activity, your heart may not be delivering enough oxygen-rich blood to your muscles and tissues. This chronic tiredness isn't just slowing down. It's a potential sign that your heart isn't keeping up. Seniors may find themselves needing more naps or feeling drained without exertion. This often affects independence and daily routines. If you find yourself avoiding activities you once enjoyed because they feel exhausting, it's time to pay attention. 3. Swelling in the legs, ankles, or feet. This symptom, known as peripheral edema, happens because the heart isn't circulating blood properly. Fluid backs up and pools in the lower extremities. Watch for socks leaving deep marks or shoes feeling tighter than usual. This may worsen throughout the day and ease overnight. Swelling can also indicate kidney involvement, as both organs are closely linked. If this swelling is persistent or progressively getting worse, especially with weight gain, it could signal advancing heart failure. 4. Sudden weight gain. Putting on 3 or more pounds in a short period, especially without a change in diet, can indicate fluid retention. Doctors often instruct heart failure patients to monitor their weight daily for this reason. Sudden gain means the heart is struggling to keep up with circulation demands, and fluid is building up throughout the body. This is one of the clearest at-home signs and should not be ignored. It can precede worsening shortness of breath or hospitalization. 5. Difficulty sleeping. Lying flat. This symptom, called orthopnea, occurs when fluid shifts into the lungs while lying down. Seniors may find themselves stacking pillows or preferring to sleep upright in a chair. If lying flat causes coughing, gasping, or restlessness at night, It may be more than a sleep issue. It could be the heart signaling distress. You may also experience paroxysmal nocturnal dyspnea, suddenly waking up breathless. If this pattern is frequent, consult your doctor without delay. 6. Irregular heartbeat or palpitations. A heart that's overworked or electrically unstable may skip beats, flutter, or race unexpectedly. This can be unsettling, especially at night or while resting. Palpitations may signal arrhythmias like atrial fibrillation, which are common in older adults and increase stroke risk. Some people describe it as a pounding or racing in the chest. If irregular beats become frequent or are accompanied by chest pain, shortness of breath, or dizziness, seek medical attention immediately. 7. Persistent cough or wheezing. Often worse at night or when lying down, this dry, hacking cough may be accompanied by white or pink blood-tinged mucus. It's caused by fluid leakage into the lungs due to poor circulation. Seniors may think it's allergies or a lingering cold, but if it persists, it warrants attention. If over-the-counter treatments don't help and the cough is worse when reclined, your lungs may be signaling that your heart isn't functioning properly. 8. Confusion or trouble. Concentrating. The brain is highly sensitive to oxygen supply. Reduced cardiac output can lead to mental fog, forgetfulness, and even dizziness. Loved ones may notice changes in alertness or personality before the senior does. These signs are sometimes mistaken for early dementia, but could be reversible with proper heart treatment. If sudden confusion appears with other symptoms like fatigue or swelling, it could indicate your heart isn't delivering enough blood to the brain. 9. Loss of appetite or nausea. As fluid builds in the digestive organs, it can make eating uncomfortable. Seniors may feel full quickly, lose interest in meals, or experience bloating and nausea. This contributes to unintentional weight loss and poor nutrition, both of which weaken the heart further. If meals feel like a chore or digestion becomes irregular, it's important to consider if your heart might be part of the problem. 10. Increased need to urinate at night. Heart failure can shift fluid during rest, prompting more nighttime trips to the bathroom. Known as nocturia, this symptom is especially common in older adults with heart concerns. While frequent urination can stem from other issues like prostate problems or diabetes, when paired with other symptoms above, it strengthens the case for cardiac evaluation. A noticeable change in bathroom habits should always be monitored in context. Heart failure doesn't happen by chance. It's often the result of multiple chronic health issues and lifestyle habits coming together over time. One of the most common causes is high blood pressure. When your blood pressure remains elevated over months or years, your heart has to work harder to push blood through your arteries. This extra strain thickens the heart muscle, which might sound good, but it actually makes it harder for the heart to relax and fill properly. Over time, this can lead to heart failure. Another major factor is coronary artery disease, or CAD. This happens when the arteries that supply blood to your heart become narrowed or blocked by plaque. Without enough oxygen and nutrients, your heart muscle weakens, which reduces its ability to pump effectively. CAD is a leading cause of heart attacks, and even a single heart attack can damage the muscle enough to trigger long-term failure. Previous heart attacks, especially silent ones that go unnoticed, can leave parts of the heart scarred. These areas don't pump as well as they should, which puts more pressure on the rest of the heart to compensate. The more your heart has to compensate, the faster it wears down. Then there's diabetes, a condition that damages blood vessels and nerves. People with diabetes are more likely to develop high blood pressure and KD, making heart failure far more likely. Obesity and sedentary lifestyle further add fuel to the fire, increasing the load on the cardiovascular system. Irregular heartbeats or arrhythmias, especially atrial fibrillation, are also dangerous. They interrupt the regular pumping rhythm of the heart and increase the risk of blood clots and stroke. A heart that's beating too fast or too slow can't circulate blood effectively, which worsens existing conditions. And finally, lifestyle choices such as smoking and excessive alcohol consumption directly damage the heart muscle. Smoking narrows your blood vessels and raises blood pressure. Alcohol, especially in large amounts, can weaken the heart's muscle walls, a condition known as alcoholic cardiomyopathy. So, when should you take action? When you start to notice patterns, breathlessness during chores, puffy ankles every evening, feeling exhausted from simple tasks. If these things keep happening, they're not just quirks of aging. They're signs that something more serious is developing, and it's time to get checked. To help you remember what to watch for, think of the heart method H, heavy breathing during simple tasks. E, edema or swelling in the ankles or feet. A, appetite loss or feeling full too quickly. R, racing or irregular heartbeat. T, tiredness that doesn't go away. If you notice 2 or more of these signs, don't wait. Talk to your doctor, ask questions, get tests done. Early diagnosis can give you more choices and more years doing the things you love. The good news is, there are proven ways to manage and even reverse heart failure symptoms. Doctors often prescribe a combination of medications that work together to reduce strain on the heart, improve blood flow, and remove excess fluid. Common treatments include ACE inhibitors and ARBs to relax blood vessels, beta blockers to slow the heart rate and reduce workload, diuretics or water pills to reduce fluid buildup, SGLT2 inhibitors, a newer class of medication especially helpful for people with both heart failure and diabetes. But managing heart failure goes far beyond just taking medication. Lifestyle changes are essential, and for seniors, these changes can be both powerful and practical. A heart-healthy diet is key. Focus on whole, unprocessed foods, fresh vegetables, fruits, whole grains, lean proteins, and healthy fats like those found in olive oil or avocados. Reducing salt intake is particularly important, as sodium can cause fluid retention and worsen symptoms. Physical activity, even in small amounts, plays a big role. Daily walks, chair exercises, or water aerobics can improve circulation and energy levels. Always talk to your doctor before starting a new exercise routine, but remember, even light movement is better than none. Other important steps include quitting smoking, reducing alcohol intake, managing related conditions like high blood pressure, diabetes, and high cholesterol, monitoring your weight daily to detect fluid buildup early, perhaps just as important as staying emotionally and mentally engaged. Isolation and depression are common among older adults with chronic illness. Family members and caregivers can help by staying connected, encouraging healthy habits, and offering consistent support. And here's a real-world example that highlights just how critical early recognition can be. Walter, a 76-year-old retired firefighter, began feeling more tired than usual. At first, he thought it was just age catching up. Then came the breathlessness while gardening, and later, the frequent nighttime trips to the bathroom. His family encouraged him to visit his doctor. After a few tests, Walter was diagnosed with early-stage heart failure. Thanks to the quick intervention, including medication adjustments and lifestyle changes, Walter regained his energy. He's now walking daily, enjoying time with his grandkids, and says he feels 10 years younger. His story is a perfect reminder. Catching heart failure early can truly turn the tide. Remember, whether you're experiencing these symptoms yourself or supporting a loved one who is, you're not overreacting. These warning signs deserve your full attention. The sooner they're addressed, the better the outcome. Doctors emphasize that what matters most is not just recognizing one symptom, but noticing a pattern, especially when multiple signs show up over weeks or even days. As with any health condition, early diagnosis opens the door to more treatment options, less damage, and a better quality of life. If this video helped you or someone you love, please give it a thumbs up and share it with a friend. Comment below to let us know where you're watching from. We'd love to hear your story. And don't forget to subscribe to Senior Healthwise for more life-saving tips tailored to your stage of life. Early action saves lives. Stay informed, stay proactive, and above all, stay wise.